Assalamu alaikum wa rahmatullah. Bismillahir Rahmanir Rahim. I am Dr. Muhammad Jamshed. Our today's topic for discussion is the joint. It is a topic of the general anatomy. The objectives of this tutorial is number one, what is the classification of the joint on structure basis? Number two objective is mechanism of the joints movements. So, what is a joint? So, the study of the joint is called the arthrology, and joint is defined as an articulation or union between two or more than two bones, or a bone and a cartilage. So, this is a simple definition of the joint. Sometimes there will be a union between the two bones. In other cases, there will be union between more than two bones. Or in some cases, the bone is united with the cartilage, and that joint is called the cartilaginous joint. An example will be given and explained later in the lecture. Our next topic is the classification of the joints. In this slide, we should know how the joints are classified. So basically, the joints are classified on the basis of the function of the joint and on the basis of the structure of the joint. The function of the joint means the movements performed by these joints, either they are movable, freely movable, or they have slight movement, or they have no movement at all. So this shows the functional classification, and other classification of the joint is on the structure basis. That what structures are present in between the adjoining bones in case of a particular joint. Functionally, we classify the joints into three parts. And this classification is based on the degree of the mobility of the joint. So the first one is called the synarthrosis. These joints are immovable joints. An example of such joint is the cranial sutures in the adults and primary cartilaginous joints in the growing children, which we will discuss later. The second type of the joint on function basis is the amphiarthrosis. These joints are slightly movable, and the example of such joints is the joints between the adjacent laminae of the vertebrae of the spine. The third one type of the joint, according to the functional classification, is the diarthrosis. These joints are freely movable joints. Wide range of movement is seen, and these joints are called the synovial joints. Now, in this slide, we will discuss the structural classification of the joints. This classification is based on the type of connective tissue and presence or absence of the joint cavity. So the joint may be a solid joint, or it may be a cavitated joint having the joint cavity. By solid, we mean that when the bone they are joined with each other, there is a no cavity or space between the joining bone in a joint. Well, cavitated joints are those joints having a cavity called the joint cavity between the articulating ends of the bone. Sorry. So the example of the first type, that is the solid joint, is the fibrous joint. Fibrous joints are composed of intervening fibrous tissue with no joint cavity, and these joints are immovable joints. Well, some of these joints they show slight movements. Examples will be seen later. Cartilaginous joints are the example of solid joints, means they have no joint cavity between the ends of the bones, but the articular bones are united by cartilage, which may be hyaline cartilage or fibrocartilage. These are two types of the cartilages with no joint cavity in between the articular ends or articular surfaces of the bones forming the joint. The third one is the synovial joint. Synovial joint, as we divided the joints on structure basis and two main groups, joints having cavity or joints and joints having no cavity. So the joints having cavity, they are not solid joints, but they are cavitated joints, and the articular bones are separated by fluid filled joint space or cavity that is called the joint cavity or synovial cavity. So these are the examples of the three types of the joints, which is based on the structural classification. So this is the fibrous joint. As we mentioned in the previous slide, that the fibrous joint and the cartilaginous joints, they are called the solid joints, and in these joints the bones are united with each other by fibrous or cartilaginous structures. There is no cavity in between these joining bones, opposite to this image in which there is a giant cavity between the joining bones. In fibrous joints, there is a fibrous tissue in between the joining bones. This is a bone, this is a bone, and this is also a bone. These are the bones of the skull. These are united by a fibrous tissue. And, and this is the joint, this is the joint, this is the joint between the bones. So the bones are united by fibrous tissue. This is an example of cartilaginous joint. Cartilaginous joint, this is the bone of pelvis. This is the pubic bone, another pubic bone of the right side. These bones are united with each other by a cartilage. So these joints are called the cartilaginous joints. These joints, as we mentioned, it has no movement or and slightly movable. These joints are movable, slight show slight movements, and these is the third type, synovial joints. These are the ends of the bones which are united to form the joint, and there is a space between the articulating bones. So These are called cavitated joints, and this space is called the joint cavity or synovial cavity, and these joints are freely movable and they show various types of the movements, which we will discuss later. First, let's discuss the fibrous joints. There are a few examples of the fibrous joints, and we will discuss these. Sorry. So, first type of the fibrous joints, as I told you, the fibrous joint, the bones are united with each other by fibrous tissue, and these fibrous tissue are of various uh, various amount and various types. The first one is the suture. The sutures, articular surfaces of the bone, are connected by a thin layer of connective tissue. Here, the connecting material or the connecting tissue between the bones is in the form of a thin layer, and these joints are confined to the skull and they are immovable joints. Though these sutures joints they allow uh, slight movement in case of the fetus, which makes easy delivery. Similarly, these show a little bit movement for the developing bone in the skull in the early age of infancy. Second example of the fibrous joints, or second type, is the syndesmosis. In this type of the fibrous joints, the bones are connected by considerable great amount of the connective tissue. Here, the amount of the connective tissue is greater than in the sutures in the form of interosseous ligaments and membranes. The connective tissue in these cases is called, the connective tissues in this case is called interosseous ligament or interosseous membranes. Here, the two surfaces of the bone, which are a little bit separated from each other, and they are united with each other by these ligaments, are the interosseous membranes. Interosseous membranes means the membrane between the two bones. Os means bone. The examples of these syndesmosis is the interosseous tibiofibular joints in lower limb and interosseous radioulnar joints in the upper limb. The third fibrous joint is the gomphosis. This is page and socket joint. Here, the articulation of the teeth in alveolar sockets of the mandible and maxilla by a ligament that is called the periodontal ligament. These are the images of the three fibrous joints, sutures, syndesmosis, and gomphosis. In syndesmosis, a thin layer of connective tissue that is present between the adjoining bones. This is the skull bone. And again, this is the suture. And the three bones are united with each other by a thin layer of connective tissue. As I told you, that It shows a slight movement to facilitating the head in delivery of the fetus, and also it facilitates the growth of the brain in the developing child, where the age is for development of the brain. When the development stage of the brain ceases, so these sutures they unite the bone, and they are replaced by a bone, and this process called synostosis. And in this example, as I mentioned here, the connective tissue is greater in amount than that of the sutures. Here, these are the bones of the upper arm, ulna, and this is the radius, and their surfaces. This is the lateral surface of the ulna, and this is the medial surface of the radius. Or these bones have a border called anterocious borders facing each other. So these borders are on these surfaces. They are connected with each other by a membrane and a ligament. This membrane is called interosseous membrane, and the ligaments are present for attaching these bones. So this is the example of the syndosmosis. The third example is the gomphosis. In this, the root, this is the root of the, this is a tooth. Tooth are present in the maxilla, upper jaw, and the lower jaw of the mandible. So these are the bones of the mandible. Are the here the roots are inserted, and the roots they are present in the mandible or the maxilla. As I told you earlier, that this type is called the pike and socket joint. Articulation occurs between the tooth and the alveolar sockets of the mandible and maxilla by a periodontal ligaments. So these are the sockets in articulation between. This is the socket of the mandible. This is mandible bone. This is its socket, and this is the root of the tooth, which is articulated with this socket by a ligament. This ligament is called the, this is the ligament, this ligament is called the periodontal ligament. Sutures. The sutures, again, they are classified into the plain sutures, serrated sutures, denticulate sutures, squamous sutures, and scandilysis. In the plain suture, this image shows the plain sutures, and it looks plain. Two bones are united with each other, and example of this type of the suture is the intermaxillary, that is between the maxilla, two maxillae of the skull bones. Second one is the serrated. Serrated means like teeth of a saw. So here the bones are united with a suture that is serrated type, and This example of such type of the suture is the interparietal, that is between the two parietal bones. So interparietal joint has a suture type of the joint. The third one is the denticulate. Denticulate, this is the image showing the example of the limboid suture between the occipital bones of the skull and the parietal bones. And here the suture is in such a form that the bones are interlocked with each other. Finally, there is scandilosis. It is a wedge and groove type. So let's discuss. We left another type, that is the squamous type. Squamous type. This is the squamous type. Here is the overlapping. The suture is in the overlapping form. The example is the temporoparietal sutures between the parietal bones of the skull and the temporal bone of the skull. Finally, the another type of the sutures, that is a type of fibrous joint, is the scandilosis, that is wedge and groove. This is a wedge of a bone, and below is the groove of another bone. So this type of the joint is called the scandilosis, and this is present in the skull bones, in which the rostrum of the sphenoid, and this is the rostrum of the sphenoid, that is a wedge, and the groove of the vomer bone articulation occurs. So this is called the another type of the sutural joints. So first we discussed a type of the solid joint, that was the fibrous joint. And in fibrous joints, we mentioned that the adjoining bones, they have a connective tissue with each other, and they are immovable joints. And again, we divided the fibrous joints into the sutures, and the sutural joints again uh, were, were of the types, various types we mentioned. Now, here we will discuss the cartilaginous joints in this slide. This is another type of the solid joint. It means that the joints, they have no cavity, but the bones are united with each other with the help of a cartilage. That is a cartilaginous structure, either fibrocartilage or hyaline cartilage, which are the two types of the cartilage. They are present at the ends of the articular surfaces of the bone. So here we divide these cartilaginous joints into two types. Number one, primary cartilaginous joints. These are called the synchondroses. These are temporary joints. Here the joint is temporary, and it is present between the growing long bones, and it leads to the permanent fusion later on when the ossification or the bone growth is completed. Look at this picture. This is a long bone. These are the two ends, one end, second end. This is the shaft. As we know that these bones, they here it these bones have ossification center, and before the formation of this bone, this was a framework was the bone was formed by a cartilage. This cartilage is replaced by the bone tissue, and when the growth of the bone is or the formation of the bone or ossification completed by the ossification, the cartilage which is present up to certain age then disappears and is replaced by the growing bone. So the bone has two parts in the growing period. This is the shaft is called diaphysis and the ends are called the epiphysis. So this is actually a type of the joint between this bone. This is the cartilage joining the epiphysis with the diaphysis. Look at this again. This is a part of the bone at the end. This is in the central part of the bone. Between the ends and the central parts, that is between the epiphysis and diaphysis, a cartilage is present joining these bones. So these type of the joints are called the primary cartilaginous joints. They are temporary. Later on, when the bone formation is completed, these are these disappears, and this leads to the permanent fusion of the bones. This is called synostosis. The secondary type, this is the permanent one. These secondary or permanent cartilaginous joints, they are located in the median plane of the body. That is between the manubrium sternum, between the bodies of the vertebrae, and between the pubic symphysis. So these are the bones, various bones. This is one bone, this is another bone. And these bones, they are united with each other by a type of the cartilage that is a fibrocartilage, and these joints show the union, and this type of union is called the cartilaginous, but it is permanent. This cartilage doesn't disappear during the life, and examples of such type of the secondary cartilaginous joints is the those between the manubrium and the sternum, manubriosternal joint, and between the bodies of the vertebrae, intervertebral joints, and the third example is between the pubic symphysis. So these are the examples of the cartilaginous joints in the body. Then comes the synovial joints. The synovial joints, the types of the joints we discussed, fibrous joints were the fibrous joints, and two of them we discussed on the basis of the structure, the cartilaginous joints and the fibrous joints which was the examples of the solid joints. Here, the third type of the joint is the synovial joint. Here, the joints we have a cavity between the articulating bones which form the joint. These joints are called the cavitated joints or the joints having cavity. They are not solid joints. These joints are most evolved freely movable joints. They have a giant cavity which is filled with a synovial fluid. The fluid present in the giant cavity is called synovial fluid. Articular surfaces of the bones which take part in giant, they are covered with the hyaline cartilage. Sorry. So, what are the various components of the synovial joint? The first, we will start from here. That is the one bone. This is another bone, and these are the articular ends of the bone. This is the articular end of another bone. So, this is the joint. The components means the structures which are present in case of the synovial joint. So typically the synovial joint has articular cartilage. What is articular cartilage? The structure which is a blue color and present at the articular ends. This one of the one bone and this part of the another bone. This is called the articular cartilage. So the type of the cartilage present in articular cartilages of the joints of such bones, they are called the hyaline cartilage. They are present on the surfaces of the bone which face the joint cavity, and their primary function is making the joint slippery. These structures, they are avascular. They have no blood supply of its own, and they are non-vascular, avascular and non-nervous. Non-nervous means they are not sensitive to the pain. They get their nourishment from the synovial fluid. Another structure that is space, as we discussed, synovial joints are cavitated joints. They have a cavity, and this cavity, this is called the joint cavity, also called the synovial cavity, as it is filled with the synovial fluid. The third structure is the synovial membrane. This is the synovial membrane, this one, and on this side, this is the synovial membrane, which is green in color. This membrane lies within the joint capsule. The pink one is the this is the joint capsule up to this area, and this is the joint capsule on another side. The inner lining of this joint capsule is the synovial membrane. This is the synovial membrane. It seizes at the periphery of articular cartilage, articular disc, or meniscus. This starts, it ends at the periphery, that is the articular cartilage. So the membrane which it reaches at the ends or the margins of the articular cartilage, we discussed the first component. So it ends here, ends here, it ends, and on this other side here it ends at the borders of the at the margins of the cartilage. Sometimes two other structures, that is articular disc or a meniscus is present. So in that case, the synovial membrane seizes at the periphery of articular disc and meniscus also. The articular disc is a structure which are present in this joint cavity. This is joint cavity. Here another structure is present which is attached at the periphery. It is attached with the periphery with the joint capsule. If a meniscus or a articular disc is present in some joints, so in those cases, here is another structure, fibrocartilaginous in nature, present in the joint cavity, and it's peripherally, it is attached with the joint capsule, and this structure which divides the joint cavity partially or completely into the two compartments. Then comes the articular capsule. This is the articular capsule, this one. The articular capsule, it invests the joints all around. They form a cuff around the joint. They are attached. The articular capsule of the joint is attached with the bones close to the articular cartilage. This is articular cartilage and synovial membranes were attached here, but here is the attachment of the articular capsule which surround the joints. It has two components. The articular capsule has two components. The outer one is called the fibrous part of the capsule, and its inner lining, that is the synovial membrane. So the structure is called articular capsule. Its outer lining is fibrous capsule. Inner one is called the synovial membrane. Again, I will repeat it. That is, this is the joint, synovial joint. Synovial joint, it is united. These are the ends of the bones which are united with each other. Synovial joints have a cavity, and these cavities, they are filled with a fluid called the synovial fluid. The articular ends, they are covered with hyaline cartilage. Similarly, this bone upper end is covered by hyaline cartilage. This is the cavity. This is the fluid, synovial fluid. In this joint, we have no articular disc or meniscus, but in certain joints, like sternoclavicular joint, temporomandibular joint, and the knee joint, we have another structure in this cavity that extends from the joint capsule towards the other end of the joint capsule, dividing the joint space completely into two compartments. But sometimes this fibrocartilaginous structure, articular disc, it is attached to the periphery, but it ends at some distance over here. Means that it doesn't reach to the other end, or it is incomplete type of the fibrocartilage. So partially divides the cavity into two compartments. The third structure is the another structure is the this is the membrane. Synovial membrane lining the inner part of the fibrous capsule, and it is attached at the margins of the fibrous cartilage, the hyaline cartilage, which is the articular cartilage. One thing should be remembered that this membrane, synovial membrane, it doesn't cover the articular cartilage, which is directly exposed to the joint cavity for its free movements. And then we discussed the joint capsule, the main structure of the joint, which invests the joint like a cuff, and it is highly vascular, pain sensitive structure, and it has outer part, that is the fibrous part, and inner lining, that is the synovial membrane part. Another structure in the joint is the ligaments. So ligaments are two types. Accessory ligaments. These ligaments, they are attached. They are in. They are attached with the. They attach the bones with each other at some parts of the bones, and give stability to the joint. This is the ligament. So there are two types. One are the accessory ligaments, others are the capsular ligaments. Capsular ligaments are those ligaments in which there is thickening of the a part of the capsule occurs, forming a ligament. So in that case, the ligament is called the capsular ligaments, while the accessory ligaments, they have no relation with the capsule and its synthesis, so they attach the bone, one bone to the other bone. Classification of the synovial joints. Synovial joints are classified into the following types: plain variety, hinge type, pivot, condylar, ellipsoid, saddle, and ball and socket variety. In plain joints, here are the articular surfaces. This is one bone, this is another bone. The articular surfaces, they are neither concave nor convex, but they are plane surfaces. These allow gliding movements side to side or front and movements in the front and back. Examples of the such type of the plane joints which or the variety of the synovial joint is the intercarpal and intertarsal joints. These are the small joints of the hand. They are called intercarpal, while those joints which are between the tarsal bones of the foot, they are called the intertarsal joints. So these are the plain variety of the joints. Another type of the joint and synovial type is the hinge joints. They are also called ganglions. Here, the articular surfaces are pulley shaped. They are pulley shaped. The movements are permitted only in one plane. That is the transverse plane. Most common joints of this variety, in which the joints move like a door in one axis. When we close the door or open the door, so in one plane, uh, and one type of the movement is seen in this type of the joints. Examples are the this is the elbow joint, humerus, and ulna. This is the pulley, and another example is the ankle joint and interphalangeal joints. This is the third type of the synovial joints. These are called pivot joints. They are also called trochoid joints. Here, the rounded end of one bone fits into the concavity of another bone. This joint is present in the between the upper ends of the ulna and the radius. It's a concave part of the ulna, and the round end of another bone, the radius, fits into the concavity of the ulna. But here the round part of the bone, which fits into the concave part of another bone, this is surrounded by a ligament, and it shows a limited rotation around the central axis. Example is the superior radioulnar and median atlantoaxial joints, that is between the axis and atlas of the spine. Condylar joints is the example. It is another type of the synovial joints. Here, a round articular surface of one bone fits into socket type articular surface of another bone. That is, the mandible fits into the temporal bone. The mandible has a round articular surface, and the temporal bone has socket type articular surface, and the joint in this is the mandible, and this is the temporal bone. This is the round part of the mandible, and this is the socket type articular surface of the temporal bone. And this type of the joint is called condylar joint. As we discussed, there are certain joints in the joint cavity, they have an intra-articular disc. So this is the intra-articular disc in the joint space. This synovial joint having a joint cavity. Sorry. So this is the joint cavity. This is divided by fibrocartilaginous structure that is intraarticular disc attached with the capsule, attached to the capsule. So TMJ or temporomandibular joint is a type of the synovial joint having the intraarticular disc. It permits the movements in two directions, that is elevation and depression of the jaw, sorry, and protraction and retraction, forward movement and retraction, the backward movement to the normal position. Another example of the condylar joint is the knee joint, where the union occurs between the femur, lower end, and the upper end of the tibia bone. Ellipsoid joints. Elliptical convex surface of one bone articulates with elliptical concave surface of another bone. As in the wrist joint. In the wrist joint, we have elliptical convex surface of one bone articulates with elliptical concave surface of another bone. That is the union between the tarsal bones and the union between the radius forming the wrist joint. So the surfaces here are of the both articulating bones. They are the elliptical in shape. Here at the wrist joint and other such type of the joints, we have movements in two directions. The combination of movements causes circumduction, that is the wrist and atlanto-occipital joints between the occiput and atlas, that is the bone of the spine. Saddle joints. In saddle joints, a variety of synovial joint articular surfaces are reciprocally saddle-shaped, concave, convex. This is the saddle type of the surfaces. It allows a wide range of movements, and the example of such type of the saddle joints is the carpometacarpal between metacarpal bone of the first metacarpal bone and the carpal bone of the hand. Another example of the sellar joint is the sternoclavicular joint, SC joint, that is between the sternum and the medial end of the clavicle. First example we mentioned is this is the metacarpal, it is metacarpal bone and it is the carpal bone. So the carpometacarpal joint, the first, it is the thumb, is example of the saddle joint. Ball and socket variety, these joints are called spheroidal joints. And here the round convex surface, that is the head. This is the head of the humerus. It fits into a cup-like socket of another bone, that is socket-like structure or cup-like structure of the scapula, forming the Scapular joint. This joint is freely movable and shows a variety of the movements. Another example of this joint is the hip joint, that is the union of the head of the femur with the acetabulum of the hip bone, forming the hip joint. These are the images of the synovial joints. First is the plain joint, the surfaces of the bones in these joints which are united with each other, they are plane variety. Second one is the pivot. In pivot, the rounded head fits into the concave surface of the another bone, allowing and rotatory movements. This is the example of ellipsoid joints, elliptical surface, elliptical shaped surfaces, concave of one bone and convex of another bone. They are joined with each other. Again, this is the saddle type of the joint in which concave, convex, reciprocal surfaces they join each other, forming the saddle type of the joint. Simple type of the joint, hinge joint, like the door, and one showing the movements in the one plane. This is the ball and socket variety, that is in the hip and shoulder joint, freely movable joints. The head, round head articulates into a cavity or the cup shape structure of the other bone, like cup shape structure in case of the shoulder joint, the round head of the humerus articulates into the cup shape structure of the scapula, that is the glenoid cavity, where in case of the hip joint, the head, round head, the femur fits into the vestibular cavity of the hip bone, forming the hip joint. Mechanism of movements of the joints. The joints have three types of movements: uniaxial, biaxial, and polyaxial. In uniaxial, there is 1 degree of freedom of movement. 1 degree of the freedom of the movements. These joints are not freely movable, but they move only on one axis. Hinge joints, they move in transverse axis, that is only the flexion and extension movements are performed. Pivot joint in the vertical axis. Vertical axis is that is the rotation of the head of the radius bone with the upper end of the ulna, and this movement is the rotation of the radius on the ulna and the which is a joint between the ulna and the radius in its upper part. That is the superior radioulnar joint. There is only uniaxial 1 degree freedom of the movement is allowed. Another type is the biaxial. Here the 2 degree freedom of the movement is present. That is either in the transverse, the movements are present in the transverse and anterior posterior axis. In the transverse axis, we can perform the movements flexion and extension, while in the AP, that is anterior posterior axis, the abduction and adduction movements are performed. Here, the range of the movements is greater than uniaxial uh, joints. And examples of the such type of the joints is condylar, ellipsoid, and saddle varieties. The third one, mechanism of the movement is the polyaxial. Here, the three freedom of the movements, like transverse axis, vertical axis, and anterior posterior axis, are present. Example is of the bar and socket varieties, that are the joints present in the shoulder joint and the hip joint. Uniaxial, that is the this joint is hinge joint. Again, this is another hinge joint. This joint is present in the elbow. Only in the transverse axis, extension flexion movements are performed. In case of the superior radioulnar joint between the head of the radius with the ulna surrounded by a round ligament, uniaxial movements of the rotation on the vertical axis are performed. Biaxial movements, condylar, ellipsoid, and saddle type of the joints are here present. Two axis movements. That is the anterior posterior axis in which we perform the movements in abduction, adduction, and in transverse axis, flexion and extend. Here the two axis movements are present. The third variety, that is the three freedom of the movements is present in the transverse axis, vertical axis, and the anterior posterior axes. These are called the polyaxial movements. Movements of the synovial joints. Gliding, number one, gliding, that is slipping. And number two, angular movements like flexion, extension, abduction, adduction, rotatory movements. These are the circular movements. The rotation, supination, pronation, and circumduction movements. In gliding movements, one bone slips over another. As we explained it earlier, like movements in the intercarpal joints and intertarsal joints. Small joints of the hands and the feet, they slips, one bone slips over another. In angular movements, there is flexion and extension of the part and like bending and straightening. These are called the angular movements. The third one is the adduction and abduction. These movements are towards and away from the median plane. The movements towards the median plane, they are called adduction, while those away from the median plane, they are called the abduction. These images show the various movements, that is in this, these are the small joints of the hand. Here the movements are called gliding movements. This image shows the flexion and extension, angular movements when there is bending of the forearm toward the arm. This is called the flexion. And what is straightening or straightening movement, another type of the angular movement. Straightening of the forearm is the extension. This is the flexion of the angular movement, flexion of the wrist, bending of the, that is the bending of the hand toward the forearm, and an extension, straightening of the hand, in abduction, normal hand in the normal anatomical position. This is now in this position is away from the median plane. When the part is away from moved away from the median plane, this is called the abduction. When the part is moved toward the median plane, this is called the adduction. Supination and pronation. In supination, when the palm faces forward, this is called a supination, and which the palm of the hand faces back on back side or posteriorly, this is called the pronation. And circumduction is another movement. Long bone circumscribes a conical shape, a conical space. What is circumduction? Circumduction is defined as successive movements through flexion, abduction, extension, and adduction. Another movement is the rotation, movement of the bone on its longitudinal axis, that is the medial anterior surface rotates medially, lateral anterior surface rotates laterally. Medial rotation, what happens that the anterior surface of the bone rotates medially, so it is called the medial rotation, while in lateral rotation, the anterior surface rotates laterally. And when the anterior surface of the bone rotates on its longitudinal axis laterally, so this is called the lateral rotation. Pronation, it is a forearm movement and in which the palm is turned backwards, that is, it faces posteriorly. In supination, rotation of the forearm, palm is turned forward. So this is the abduction and adduction as we mentioned earlier. And this is the flexion and extension of the arm at this joint. We discussed medial rotation. This is the anterior surface of the bone. Anterior surface of the bone. When the anterior surface of the bone, in case of its rotation, the anterior surface faces medially. This is called medial rotation. When the anterior surface of the part of a structure or the arm, in this case, it faces laterally during the rotation. This is called the lateral rotation. In circumduction, the movements we discussed is this is the cone around movement, and the cone is at the joint. This is the cone is formed. This is the narrow part of the cone, and this is the wide part of the cone. So this is the cone is formed. In definition, we discussed circumduction, successive movement through flexion, abduction, flexion, flexion, abduction, and extension and adduction is defined as the circumduction. That is the supination, rotation of the forearm in which palm faces anteriorly, impronation, rotation of the forearm in which the palm or the hand faces posteriorly, inversion and eversion. This movement, the foot moves medially, and eversion, the foot moves laterally. Medial movement toward the median plane. The movement of the foot is called inversion. And in inversion, the medial part of the foot is raised from the ground, while in eversion, it faces laterally, and the lateral part of the foot is elevated from the ground. Protraction is the movement of the mandible forward. Retraction is the movement of the protracted part backward to its starting position. Elevation of the mandible is the other part of the body is the lifting the body part superiorly, and depression is the moving the elevated part inferiorly. Opposition is another movement in which is the touching the thumb to the tips of the other fingers of the hand.